Look very healthy.
I am. I am healthy. I'm healthy. I take care of myself.
I love
That's what
to
you
hear
have to
that.
do. You have to be in charge of your health and take care of your health, especially with type 1 diabetes, because no one else can manage it for you. It needs day-to-day management. So,
100%.
okay. Hello, everyone. This is Nayiri from Low Carbon Fasting. Today's guest is a critical care doctor. According to his website, he cares for the sickest of the sick in the intensive care unit at the Ottawa Hospital in Canada. He's also a researcher, and his research focus is improving palliative care access and making ICU services more efficient. He's also associate professor of medicine at the Ottawa University or University of Ottawa. He's an advocate of efficient healthcare and breaking down the social and racial barriers to health. Not to mention, he's also a father, husband, and on top of it all, he's also an author. Kwajo, Dr. Kwadwo Kyeremanteng, welcome to Low Carbon Fasting.
Thank you so much for having me. This is a true privilege. You are an innovator and somebody that's having an important conversation. So it's a real privilege to be on the show.
It's an honor. I've been looking forward to this for a year. You will not believe, honestly, because I added you on my list exactly 1 year ago, perhaps even longer, because it was during lockdown that you caught my attention, and your stance during lockdown and your courage to speak the truth. Being an intensive care unit doctor, it really impressed me because not many doctors at the time were speaking the truth, medical truth. Anyway, let's go back to the beginning. How do you do it all?
How
How
do
do
I
you,
do?
how do you do all of this?
Oh my
What
goodness.
drives you? Something must be driving you.
That's a good question. The so I'll say logistically how we do this all is a lot of help. I have two admin assistants, one focusing on research and my department head role, the other with all my other extracurricular activities. To build a really great team behind me that helps produce the podcasts, that help edit the podcasts, the video posts. Like I'll call myself a master delegator because otherwise you can get nothing done. I very efficient with my time. Like I try and stick with some rules that allow you to be more efficient with your time. Like I try to look at my email only a couple of times a day. I try to, especially not looking at it over on weekends. I try to really condense activities. But your question though, what drives me? I don't know if I've been asked that question directly before. A lot of the some of the work that we were covering during the pandemic, I think a lot had to do with justice and equity. Like when you see a lot of people suffering that, for example, would benefit from more resources, at the same time, also hearing about this messaging and this negative emotional state that we were all in. I felt the need to shed some positivity and to give a realistic slant on a lot of these things. Uh, there's also that lens of justice when a lot of our community members are getting sick and dying when they if they were to get healthy they would be avoiding landing in ICU, and so there's a real push for that. But I mean you might appreciate this as a fellow minority person. Like often to get a seat at the table you have to go the extra mile for them to see you, and it's hard to dim that muscle, to dim that light. I'm often thinking you got to do more. You got to really make sure that you cement your position, rightfully or wrongfully. And part of that has to do also with the pandemic, like experiences that I had in the pandemic. Like, as you could appreciate, being vocal about how I felt about some of the lockdowns and some of our extreme measures, how we didn't treat our kids the best way. That that really promoted some cancel culture. Like, I had threats to my job, threats to our family, and so you feel like quite often things can be gone. So you want to be able to cement your position or diversify in some ways, how you could still contribute. And so I think that's probably been a big driver as well over the last little while, at least.
Injustice, you said. I think, that's a big driver. That's a big driver for all people who work as advocates for whatever cause it may be. It's because they cannot just sit down and do nothing when they see injustice. During the lockdown, were you an ICU doctor at the time? What did you witness? What conditions were people coming in with? Obviously, COVID, I mean, people getting hospitalized for COVID, most people at least had other comorbidities. So let's talk about that. And because I want that to lead to the metabolic health sort of channel, because that's what you're doing at the moment. So
Absolutely. So I feel like it was controversial to say this at one point, but I never once during the pandemic took care of somebody that was completely healthy. It
yeah.
was always somebody that had risk factors in the ICU. So it could have been extreme age, could have been immunocompromised, but predominantly it was people with metabolic syndrome.
Mm-hmm.
And even the young patients that we did see at some point during the pandemic, mostly during the third wave, so April 2021, I would guess the average weight of those patients were approaching 300 pounds. So you would, and of course, on the media they would say young people dying with COVID, getting sick with COVID, but they didn't mention that they were extremely obese. So those were the things that we saw, and for me, I did a lot of research on how you can reduce healthcare spending and be more efficient. It became abundantly clear to me that prevention was key. So you land in ICU at the time, say in April of 2021 with COVID. If you ended up on a ventilator, you were intubated or on a ventilator for minimum 3 weeks during that time. You were away from your family. You were going through hell, essentially. And it was awful. I think we had about 33% survival rate at that point. And that's a lot of people. Sorry, 33% mortality, I should say, 33% mortality at that rate. And a lot of patients ended up never the same with chronic lung conditions, issues with right sided heart failure, many complications. And the epiphany for me was, instead of focusing on on treatment within the ICU, why do we put more of our eggs in how do we avoid people from landing in ICU? So improve their metabolic status. And that's been now a super passion of mine. Like, how do you eat better, how you move better, how you reduce your stress, the need for community and connection. So that was the big aha moment for me during the pandemic.
Yeah, as you said it, so people were coming in with a number of comorbidities, and yet no one was talking about improving metabolic health. No one was mentioning the importance of sunshine. They closed down our parks and beaches. Anyway, so I just hope that more people now, for 3-4 years on, realize the importance of metabolic health. Dr. Kwajo, how would you define? I mean, what is metabolic syndrome, right? I mean, my channel, my audience will know what metabolic health is. I've discussed it over and over again with many of your fellow sort of physicians like Dr. Ovadia and many of the rest. So they are familiar. However, if someone is watching for the first time, what is metabolic syndrome?
Yeah, it's essentially, I mean, to simplify it, it's the syndrome associated with type 2 diabetes or prediabetes, obesity, especially central obesity, dyslipidemia, so cholesterol being off, high blood pressure, and elevated triglycerides as an example. So your inability to metabolize efficiently, and ultimately we see multiple conditions associated with it. So heart disease, stroke, cancer, Alzheimer's. Now we're emerging evidence around mental health, around depression, anxiety, uh, and and bipolar disorder. Some evidence that improving improving metabolic health can improve those mental health conditions. So all these things are directly tied to metabolic syndrome. So this is why it's such an important lever. It's such an important thing to address for our population. I've read a stat, I've seen mixed stats, but I would estimate anywhere from 33 to 50% of patients that I see in the ICU have metabolic syndrome as well. So if we can do our best to address these concerns in our community and not only highlight the awareness, but also learn ways on reversing it. Like this is where I didn't realize until being a podcast host that a lot of these conditions are reversible. I never learned that in medical school. I just assumed that once you started the diabetic path, eventually you'll land on insulin and all the complications thereof. So the last few years have been an absolute journey and eye opener and a big aha moment for us. And it's just been really exciting to have this hope that we can get a healthier population that's metabolically healthy.
So, as an ICU doctor, how much freedom do you have to impart your knowledge on nutrition and disease reversal to your patients? Are you even legally, well, not legally, but as far as medical ethics are concerned, are you allowed to discuss nutrition or metabolic health with your patients?
I would think we are. I don't think there's any constraints regarding that as far as I can think of, because we want to have a holistic approach to our patients. The issue is when they see me, it's like too late. Like it's the patients are often not conscious. They have such significant other issues that we need to focus on that this really does take a back seat, unfortunately. So like if you come in, say example, we'll focus on respiratory illness such as COVID. I need to focus on what the respirator is doing, making sure our settings are correct, make sure the heart's okay, making sure that the blood pressure is okay, making sure that the kidneys are happy, making sure we're avoiding any other complications that are associated with prolonged ICU stay. So there's so many other priorities. If they're at a state though, when they're ready to leave ICU and they're conscious and they're competent and they're interested in these topics, I'm more than willing for sure to have that conversation. But I've only once had a conversation with a patient in the last, say, 4 or 5 years about lifestyle changes, and that was around keto. There was a patient that was interested in a ketogenic approach, and so I provided some information there and encouraged them that this might be a viable option for them. But yeah, unfortunately, in my day to day, there's just so much other things happening that it takes a back seat.
Yeah, there's so much trauma with your with your work, because you're not like a GP. A GP may see the same patient every 3 months, every 6 months. You don't have that continuity, so you really, in critical care. So that makes sense. So okay, what is the best thing that people can do to obviously improve their immunity? Everyone knows of vitamin C. They keep drinking those vitamin C, fizzy tablets and thinking that, they're doing themselves a favor. So is that enough?
It's a good question. I've never been asked, you ask great questions. I've never been asked that question before in terms of optimal strategy for the immune system. Like there's a few things that come to mind. Like if you're talking supplements, rightfully or wrongfully, I think vitamin D would be important. I think zinc is in and around the time of an infection can be impactful. I just think one of the most important things, this might be out of left field, is your stress management. I see a direct link with stress and immune function and people's, whether it's just a upper respiratory tract infection or something more serious. I just see stress being a huge driver, and so I'm a big fan of, like, if you're really want to avoid getting sick, it's how do you mitigate your stress, and that starts with sleep for me. I think a lot of people, especially in my line of work, they're not getting the adequate sleep duration or quality that they need. So my, what I do at a personal level is if I'm even feeling maybe a little bit run down, making sure I get a good quality sleep in, go to bed early. But if you're looking for more general advices, honestly, I don't know if there's a magic bullet except for just like general healthy living, being metabolically healthy, not overdoing the processed
Sugar.
foods, uh, like staying active. I think all those motherly statements are appropriate, but yeah, I think of sleep as being and stress management as being number one in my eye.
Yeah, when you mentioned some of the supplements like vitamin D and zinc, I remember they were actually prescribing these supplements at the hospital for. I know a few people who ended up hospitalized with COVID, and these were prescribed to them from the hospital. So they are important. But also, I think what you eat. Food plays a big role in your immunity, right? So if you're just eating pasta and bread all day long, you're missing on some vital nutrients. And B, the glucose impact may be a little too much for the human body to process.
Yeah, it's a fair point. Like I think when we see illness, even in my line of work, it's all surrounds inflammation. Like even if we talk about COVID as an example, most of the time they land in the ICU, they won't. There's no virus in their lung anymore. It's just post inflammation. It's that inflammatory response. So when you think about that in terms of staying healthy, anything that's less pro-inflammatory to me makes a lot of sense. And you're more pro-inflammatory when you're stressed, when you're sleep deprived. But yeah, if you're thinking about nice steady insulin control, glucose control, foods don't that are less inflammatory, I think that makes a lot of sense as well.
Mm-hmm. So when I introduced you, I did introduce you as an author. I forgot to say podcast host. I will put the link in the description below. But let's come back to your book. Okay, so your book. So the title is Unapologetic Leadership, Finding the Moral Courage to Do the Right Thing. I must admit, I haven't read your book. I will buy the Kindle version. I will read it and invite you back so we can discuss specifically the book and my favorite parts of the book. However, can you give us a brief description of actually on Amazon, people? If anyone is viewing this, I will put the Amazon link. When you go to Amazon, there is detailed breakdown of the contents of the book and the main or the most important points. So go check it out. How would you describe what is the book about? Moral courage. I like those words, by the way.
Yeah, it was motivated by the lack of leadership we had during the pandemic.
Mm.
To be frank, I was stunned at how we just abandoned patient populations, socioeconomic people, different socioeconomic groups. We made decisions out of fear as opposed to looking at our values. And I saw this, and I'm a father of three, and I often like to think of the lens of how I'd like to behave or how I'd like to respond if my three boys were watching or paying attention. And I was not comfortable sitting on the sidelines when this craziness was happening. And I felt the need to speak on the approach to leadership. Like to me, this was crazy. Like leadership is by definition, I feel like you're making tough decisions, and it's centered most often on values, and that's what we need to do. And if we were doing that, we wouldn't let our kids suffer. We wouldn't let our, at least where I stand, we had some of the longest school closures globally, or at least in North America. And so I just I couldn't believe what I was seeing, and once again thinking to my boys, I was like, here, you know what, this is a roadmap on how you lead. Like I never viewed myself as an aspiring leader, but it was kind of almost fell into it because of a need to speak up. So for those, most of you won't know this, but because of our podcast, we had a little bit of local notoriety. So they were looking for somebody to speak on COVID updates during the pandemic. So I was the guy in Ottawa, and then started to get more opportunities to speak on a national level. So I'd do almost in the heights of it, I was doing daily updates nationally, uh, talking about what we're seeing. And one of the things that my wife and I both agreed on is we can't just sugarcoat some of this messaging. We have to talk about some of the real concerns we have, real concerns for the ethnic communities, the lack of support that they're getting, how we're treating our kids, how our fear messaging is going to have some long-term impacts on our population. And the principles we used to move forward were outlaid in the book, like values over fears, favoring action, doing something about some of the problems we saw. As an example, we started a metabolic health clinic for our Black communities in Ontario, as a result of some of the what we were seeing firsthand. We really talk about embracing outside the box thinking, outside the convention. That's another principle we talk about, and the magic of diversity, having that diverse perspective. I think those are the four main leadership principles led that that I feel like are uh, can create a great environment for a leader. We talk about a few other ones, but that's that's essentially why we wrote the book.
So who wrote it with you when
I
you
say
said?
we, like, collectively, like it was like the editor was Linda, but my wife wrote the foreword as an example. I mean, so everything we do is a team effort, right? Even if you don't you didn't write a single word, but like if I look at my research team for carrying the weight while I'm writing this book, my mins to help create the time to get the book done, our social media team that helped publicize it and promote it. Like it truly is a team effort.
Okay, so let's come back to the sort of ICU. Obviously, not all patients. Maybe during the lockdowns, the majority of patients maybe had the COVID or inflammation as a result of COVID. But so what sort of patient profile do you see generally? Say now this year, now in 2025. Is it acute injuries mostly?
Yeah, like you get. I'm in an ICU that's quite diverse. So the one I'm at physically in this building in Ottawa today is a trauma center. So we get the trauma patients, it's a neural site. So anybody that's had a bleed in their brain, strokes, aneurysms, traumatic brain injury, they come to this site. There's just general ICU patients, so the patients that had bad infections, bad heart attacks, and so forth. So it's quite vast in the patients we see. But as I mentioned, I would say at, in general, anywhere from a third to 50% would have some metabolic syndrome, elements of a metabolic syndrome. There's a lot of, they're not always landing in the hospital as a result of metabolic syndrome, but there's certainly links to it. And what we see as a result is their stay complicates their stay. You know, when you don't have that lean muscle mass, your recovery takes longer. Your when your sugars are all over the place, you become more inflammatory and potentially more at risk of further infections. So there's still an importance, even if you land in here because of a car accident. If you're not metabolically healthy, you're 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 adding a layer of complication.
So talking of recovery, how important is protein? I mean, good protein source. Talking about, I saw your Instagram reel when you were mentioning your top three protein foods.
Yeah, I mean, I'm biased. We haven't met personally, but I'm a big proponent of increasing your lean muscle mass for several reasons. It makes you more metabolically healthy. Muscles soak up glucose. You'll see with high protein, higher lean muscle mass, the glucose is better controlled, less swings in your blood sugar. You are fuller. You are less likely to crave junky food. So there's so much benefits of increasing protein intake. But in terms of your question directly, I'll give you an indirect example. I took care once of a guy in his mid 70s that had a cardiac arrest. He died, and then his wife luckily revived him through CPR. And people in their 70s that land in ICU after dying for a period of time usually don't leave hospital if they survive. But this young 70-year-old man was a guy that went to the gym every day or 5 days a week, and he had that I like to call body armor. He had a good amount of lean muscle mass, and as a result, more likely to rehabilitate. He had that mindset and also physical attributes to get moving and to be resilient. Just like those guys that don't feel like going to the gym every day, but you do it anyway. You realize how important it is, and he's at home playing with his grandkids now, and that was a direct result of muscle and protein. To me, is that's the important lever. And then when I think of recovery in the ICU, like if I'm being honest, like the nutrition we give our patients is not good at all, and I think we're getting better at focusing on increasing protein intake, but a lot of it gets put aside because a lot of people come in with kidney problems. They have other organ dysfunction that makes them anxious to increase their protein. But I think when in the appropriate situation, like I'll tell you this much: if I'm in the ICU for whatever problem, we started our own protein company. I'm like, bring the shakes to me. I'm having some. I am having my protein shake, making sure I get my point. At that point, I would want 1 gram per pound, because you lose a ton of muscle when you're critically ill. But yeah, I think it would be so important from my perspective.
Yeah, my next question would have been about your protein shake company. So tell us more about it. I think it's called GYATA, Gayata? Is that
Yeah,
how
I
you
got
say
it. Yeah, no, you
it?
nailed it.
What a
Yeah,
beautiful.
it's
Okay, so what is it?
yeah. So we started this roughly in September. It translates in my native tongue in Tree in Ghana is lion, like which represents strength. And I've been preaching protein intake for years, and to me, it just made sense to be able to give people that healthy option, that reliable option that is premium brand, Health Canada approved, that I was comfortable putting my name behind. Like it had to be high quality and produce goodness. So I just wanted to provide our audience with a way of getting healthy and getting strong. And this is a simple lever, I think, for people increasing your, like, no, I'm not saying everybody needs to have a shake. In fact, I would rather you just eat your protein from normal sources. But if you can't, you're on the go. Like I'll have a shake probably only about 3 times a week because of how busy you get and so forth. But what a nice, easy way to be able to get your, like the way I produce my shakes, usually around 40 grams of protein when after I put in my Greek yogurt and so forth. But I think it's just such a nice, easy way to stay healthy and to stay fit that I wanted to be able to provide our audience with that option. And so it's been, I won't lie, it's been so much fun being able to get behind a brand. My kids all have the gear. They have shake. I mean, we tend to give them shakes quite frequently because it's with their sports and they don't quite often don't have big appetites in the morning. So it's a nice thing to make sure they get their macros and so yeah, it's been an absolute fun experience.
So it's a new is it Canadian company?
Yeah, I mean we ship everywhere in the world, but me being Canadian,
Yeah.
we produce it here. Just and yeah, it's been an absolute joy being able to do this.
The link will be below, people. So check that one out too. So I actually saw whey protein. Are you doing any other or proteins or just whey?
We are going to be adding our rice protein for those that can't tolerate whey. It's less delicious, but I know it's important for people to have that option because not everyone tolerates this. But this is a thing that I'm so proud of because it's so clean. Like it's like we use protein isolate from New Zealand. Like all my kids are lactose intolerant, but for whatever reason, they just seem to tolerate this very well. So it's to me it was an encouraging sign. But yeah, we'll have rice protein early in this quarter or later in this quarter, I should say, and yeah, and we're hoping to add creatine in the second quarter.
Well, you're gonna open what?
Oh, we're gonna add creatine in the second quarter.
Oh, that would be good. Yeah, that
I
would
think
be.
yeah, because if I'm thinking about a supplement that I take daily, like I take magnesium at night, I take vitamin D, but creatine to me is a no brainer, and so I think having that adding that to our resume would be absolutely awesome.
Yeah, I've recently actually started creatine supplements, being in perimenopause and experiencing all the brain fog and the fatigue. It's making a huge difference, massive difference. In fact,
I love it.
the first couple of days I took it, I was like working out with so much vigor at the gym. I surprised my husband. I was like, What's taken over you? I said, must be the creatine.
I
It's
love it. I love it.
incredible. Yeah, incredible energy source. And yeah, obviously, you have to still eat good food. As Dr. Kwajo recommends, chicken breast was his number one choice of protein, chicken breast, I think. And then it was ground beef and steak.
I mean, honestly, I think as long as I don't really care what you take in, but I'm I should preface this by saying those are my favorite sources. Um, even like chicken thighs, if I'm being more honest, I probably like that more than chicken breast. But giving me some ribeye steak, oh my god, that's the happiest you'll see me. Period. You put a steak in front of me, and like nobody's talking to me, and I just get to be be one on one with my 16-ounce or 20-ounce ribeye. Oh, I'm a very happy man.
Dr. Kwajo, next time I see you at one of the conferences, I'm certainly going to approach you when we'll hopefully meet in person. Which one are you going to next? Because I think you have been at the SMHP conferences in the past.
Yeah, I that's a good question. I need to talk to my admin. This is where I'm saying I'm lost. I
Yeah.
need to talk to my admin with the next conference. There's one I know we're doing something in Vancouver and Calgary, but stay tuned. I'll have to get back to you on which one what we're doing next.
Because it'd be good to meet you. I think I saw you at one of the SMHP conferences. I believe it was the San Diego one. Have you ever been to the San Diego one? Was it San Diego or Boca Raton?
I was supposed to be a speaker this last Boca one, but I haven't been to Boca yet. I haven't done San Diego.
Haven't done
Did
so.
low
Where am I?
carb
In you
Denver.
somewhere.
Did you
London?
low did you do low carb Denver?
I didn't do that one. Have you been to the London one? The
Oh, I wish.
one in the UK?
Oh, I need an
I'll,
invite to that one. Hey, organizers, UK, let's
I'll
do
see what
this.
I
Let's
can.
make this happen.
I'll see what I can do. I really can see what I can do. Okay, now, um, given that this channel is called Low Carb and Fasting, so that's actually the name of my business as well. I'm all over social media and I'm a accredited metabolic health coach. So, what are your thoughts on low carbohydrate diet and fasting? And by fasting, I'm not talking about 30 days of not eating, intermittent fasting and that sort of thing.
Okay, well, I'm gonna give a disclaimer first of all. I I've been doing intermittent fasting for half a decade. I love it personally. Like my first meal was at 11:30 Eastern time today, and I've been having this approach to my own health, and I feel like it's been an absolute blessing for a few reasons. One, gets me out the door quicker in the morning. Just get my coffee and I'm out. Second, working out in a fasted state, I'm never like feeling that sluggish feeling. There's some mixed evidence about whether it's beneficial or not. I'll just say for myself, it works for me. Third, because of like I'm not small, and I'm active. I usually allow myself about 3,000 calories a day. I get to eat, as long as it's quality food, I get to eat as much of it as I want. I don't think about the quantity. I just eat. And that is an absolute peace of mind. It's an absolute, to me, it's freedom to be able to approach eating that way. And so from a, and like when I started to introduce intermittent fasting, my body, my fat percentage went down. My lean muscle mass initially went down, but then I started to amp up my protein, and now we're back to being fierce. All right. So in general, I just think it's a great tool, not for everybody, but for a lot of people to be able to either control their weight or to help them lose weight. There's a lot of debate on whether it is you're just reducing your calories and that being the main lever that you're using, or is there some impact of having a prolonged fasted state? I I'm not sure where I sit, but I certainly think that having periods without having food in your stomach is probably a good thing. And if you are obese, if you are pre-diabetic or diabetic, what a great option to try and reverse your diabetes, improve your metabolic state. It's definitely worth considering if if you got an eating disorder, if you get stressed during those time windows, then I don't think it's for you. I've seen enough people fail on it where I think where you know you talked to me 4 years ago. I'm like, everybody should try this. I do think it's most people should try it, but I wouldn't be married to it. I've seen enough people, especially in the perimenopausal groups, that where it just doesn't seem to jive with their goals. Um, and then in terms of low carb, I've never had to go true low carb in my own life, but I've seen too many people succeed with it. Like I just think having that nice steady uh, insulin and glucose, I think the type of foods that you're avoiding that are calorie dense by nature, I think that's an aspect to it. But I've seen way too many people succeed with low carb or even keto. And I do think low carb is sustainable, which is what I like about both fasting and low carb. As I mentioned, I've been doing this for 6 years with the fasting, so I'm the case that it is sustainable. The low carb, I once again, it's not my cup of tea. I would say I'm lower carb, not low carb, but I've seen many people sustain it for years, which is to me one of the most important questions to ask. Can you continue to do this? This is one of my concerns with keto is that yes, it's a lot of people have succeeded with it, but it is hard to maintain. And so you know, if you have that muscle, give it a shot. But but yeah, that's my always been my concern with keto. But yeah, I'm a fan of both.
Yeah, I mean, I personally never really define low because wherever you are, if you lower your carbohydrates, your metabolic health is going to improve. There's no doubt because I've seen it in my coaching sort of practice. I see people don't even need to go low carb as you know, and like Dr. Eric Westman recommends, right? 20 grams. Obviously, if you do that, instantly you're going to see benefits. But people see benefit in their A1C and blood glucose fluctuations by just reducing their carbohydrates a little bit, a tiny bit, by 50 grams, and it still makes a difference. And so that's why I never really define. I always tell people it depends, you know. I have to be very careful with my carbohydrate intake because I need to manage it with insulin, and that's a hell of a task. That's not easy to do. So the less impactful the food is, the better I can manage it with insulin. So that's why I choose to eat low carbohydrate meals. As for the fasting, when you said you've been doing it did you say for a decade?
Uh, I'll say 6 years, 5 to 6 years now.
For 6 years.
6 years. Yeah.
So I've actually been, without even realizing it was called intermittent fasting, or you could even do that, or other people were doing it too. I started it in the year 2000. So I always joke to my friends saying that the last time I had a morning meal, breakfast, it was, and it was cereal. So it was Weet-Bix. It was in the year 1999. So
Wow.
nearly 25 years I haven't had a morning meal. So we have two meals generally, and that's good enough for me. But yes, it's not for everyone. By the way, if you are type 1 diabetic and if you are interested in a ketogenic diet or low carbohydrate diets and fasting, my private group link will be below too. You're welcome to join. Dr. Kwajo, is there anything we left untouched?
Like I said, Mary, you number one, you're killing it. You're doing such great work for people, eh, covering great topics, such an important issue addressing people's metabolic health. So I just want to take a second to commend you. Uh, Number two, I think we hit most of the things. Like as I said before, I've been just almost like a new person wanting to empower people and in terms of realizing like you can do this, you can improve your metabolic health, you can avoid seeing someone like me in the ICU, This is so important because I've just to give some context to it. We had a family friend, one of my kids' classmates, played hockey with his kid. His dad, same age as me, just recently passed away on suddenly at home, and it was just another kind of wake up call for me, and I'm sure many other middle aged folk. That's to say, like, we almost have a duty to try and be healthier. Like, if we have that ability, this guy, father of three, business owner, like just a amazing human being, and so many people are affected by this loss. Like we got to do our best to stick around for our littles, for our community, for our loved ones, and the stuff that we're doing, you and I talking about this, it matters. It really does matter. Like to see someone like me in an ICU in that environment, it's not good. It really isn't. Like we should be doing everything we can to avoid using the acute care system because you don't quite often you're not coming out the same person. So think about what we're eating, think about moving that body, pushing weight, reducing our stress, connecting. It's all important. And we could do this together.
With that powerful message, we're going to say goodbye. Thank you for watching, and thank you so much, Dr. Kwajo, for coming to my channel. We'll have to repeat this. We'll have to do it again and discuss your book.
Oh, absolutely. And if it's not too late, I don't know when this will come out, but in April we'll have a new book coming out along talking about these very issues. We're mixing. The title might be Prevention Over Prescription or Vital Shift. We're kind of on the fence on that. You can find us on social media on Quadcast, KWADCAST. Unapologetic Leadership is on Amazon. Guide and Nutrition, as we talked about, is a supplement brand. But yeah, we are collectively trying to change the game, and I just really appreciate the opportunity to come on the show.
Thank you so much. Bye for now.
Bye bye.